Turning away an unvaxxed customer from a business, some say that's fair. But turning away an unvaxxed patient looking for medical care, bioethicist Kerry Bowman says bad idea.
I think it sets, from an ethical point of view, a terrible precedent. If they're considering not doing it because they think the patient's making a bad decision, we're rewriting medical ethics and we're rewriting human rights.
Yet it's happening to Americans south of the border. Some doctors cite safety concerns of their staff. Others who refuse to perform organ transplants say the risk of an unvaxxed patient dying is higher. I asked every provincial college of doctors and surgeons whether they've received complaints from Canadian patients about being refused care. Ontario says they've had 68, including concerns of lack of in-person care. New Brunswick says less than 5. Nova Scotia had 1 or 2. BC had 0 complaints but heard concerns. Alberta does not track. And Manitoba, Quebec, Saskatchewan, and PEI cannot disclose. And Newfoundland did not get back to me before deadline. In an email, the national organization representing Canada's medical regulators told me that cancelling a surgery for a patient's welfare would be a clinical decision made by that healthcare provider. Otherwise, the Federation says physicians have a, quote, ethical obligation and therefore cannot refuse to see patients who are not vaccinated. They should instead find alternatives, such as scheduling patients at the end of the day where there's less contact with other vulnerable patients.
In Canada, we haven't heard about particular cases. Certainly, it is something that we've talked to people who are concerned about being turned away or denied service.
Lawyer Andrew Monkhouse says if you're denied care in Ontario, you could file a complaint to the Human Rights Tribunal, but it would be difficult to fight. But if you get health complications as a result of being turned away, it may be considered a breach of the Charter of Rights and Freedoms, something you can sue for in court.
Monkhouse says doctors will probably be reluctant to deny patients care because they want to avoid complaints to the provincial regulator. But whether or not those complaints actually bring about repercussions is a different story. Noor Ibrahim, Global News.